she's not eating too much. She has tried several weight loss regimes. She has at one point most likely even considered surgery to lose weight. But it's possible she has not thought about the fact that she might have PCOS. Hello, my Red Tribe, and welcome to another episode of Doctor Red Diaries. This is a continuation of our previous episode. I talked about menstrual pain, but today I'll be extensively talking about the medical conditions or some of the medical conditions I mentioned in my previous videos. Fibroids, I mentioned endometriosis, and I'm also going to talk about PCOS. Let's get into it. All right, let's start with endometriosis. I gave a definition of what endometriosis is in my last video, but let me just talk about it again. So there's some tissue that tends to grow in the body, in the uterus, similar to the lining of the uterus, grows outside the uterus. You understand? And it can grow anywhere. When I mean anywhere, I mean it can grow on the ovaries, fallopian tubes, the bladder, intestine, pelvis. Specifically in organs or structures that are around the womb. That's where those lining can grow. It's not supposed to grow there. It's supposed to grow inside the uterus. Those linings supposed to be found inside, and those tissues be found inside. When they start growing outside, it becomes endometriosis. That's the simplest way to define it. And every month, it reacts to hormones. So when it reacts to hormones, because it is growing outside of the womb, the blood has nowhere to go. So do you understand the step I'm explaining now? Severe pelvic pain, painful periods, sometimes it causes fainting, vomiting, pain during sex. It's one of the most common medical conditions for women that always experience pain during sex. You may have to go and do some tests to be sure that you're not dealing with endometriosis. Even difficulty conceiving, infertility. Why? Because of these reasons that I mentioned. Let's talk about endometriosis in depth now more. So there's some of the things that I mentioned in my previous video that when women deal with menstrual pain, painful menstrual pain caused by endometriosis, for example, most times it's been diagnosed for years. Late detection. Some women are told that they are exaggerating the pain because trust me, it is very painful. I'm sure some women, if you've experienced painful menstruation before, I'm thinking amp it up, maybe times 10, even times 100 for some people. Some people faint because of that pain. That's how painful menstruation can be with women that have endometriosis. And then, what are some of the challenges too? Even the cost to run this test, apart from transvaginal scan, you might have to do maybe laparoscopy. For severe cases or worst cases, you might have to do laparoscopy. And for some women, they're emotionally burnt out. Why? Because they've taken medications, they've done so many things, but they are not feeling better. And many women can go 5 to 10 years before they get diagnosed, which means, can you imagine a woman, I'm not saying 5 to 10 years, I'm not even more, because I'm saying from the time they attend menarche now. Think about it. Some people, they may not have, because of at the age they attend menarche, they may not be able to, they'll be dealing or managing the pain. Sometimes it can even go more than that. It might run till when they become fully adults and they are now in charge of their own lives, and they decide to go and see a doctor and then get the test done. You can imagine years of suffering or years of being in pain. It is quite a lot. What are some of the solutions for endometriosis? Number one, early detection. I always talk about early detection on this channel. Early detection. Severe pain is not normal. So if period is stopping you from functioning, please see a doctor. Number two, we do a lot of pain management for endometriosis. We give NSAIDs, hormonal therapy to suppress the growth that is happening outside of the uterus. Then we talk about fertility planning, early fertility discussion to check for the chances or for the options But one of the most common treatments actually is surgical treatment. That's where I mentioned the laparoscopy. They do the laparoscopic surgery to remove, the idea is to remove those lesions. Because when the lining is going outside, it causes like scars. Let me use the word scar, but we call it lesions around those organs that I mentioned earlier. So we have to do surgery to remove those lesions where necessary, especially if it's really causing long-term infertility. We have to take it out. That's that is currently the best solution, and we do it as laparoscopic treatment. I did not say cut the woman open and be looking for tissues. No, please. Laparoscopic are more non-invasive than the full exploratory. You understand? That's the best treatment for endometriosis. Let's move to the next medical condition, PCOS. PCOS is also one condition that is not really talked about, and I've seen a lot of women being body shamed because they have PCOS. It's a terrible thing. Stop body shaming people. Please stop it. PCOS, let's talk about it. Let me now paint a picture for you. Let's say Amaka, for example. Her periods irregular from university or even from when she attended menarche. Sometimes she will see the period for 3 months, sometimes 6 months, sometimes even a year. Yes, they would not see their period for 1 year. They are not on any medication. They just won't see their period. She gains weight easily. She has a lot of acne. She has even male features, like male hair is growing on her chin, mustache, sideburns. She has a very interesting the body, the weight gain is on some certain areas of the body, not evenly or properly distributed. And that is dealing with what? PCOS. And those are the symptoms actually of PCOS. Even though you tell Ada, for example, stop eating, you're eating too much. I can tell you for a fact that Ada is not eating anything. I can tell you that she's starving herself, but she cannot lose that weight. She's not eating too much. She has tried several weight loss regimes. She has at one point most likely even considered surgery to lose weight. But it's possible she has not thought about the fact that she might have PCOS. Why? Because I've seen a lot of women that live with irregular menstruation and they just go on with their life. I don't know why. But this video is here for you to tell you cannot continue your life that way. There are solutions. I've seen women that have dealt with PCOS, even popular celebrities that have dealt with PCOS, and currently they are either pregnant or they've given birth. They took in and they gave birth. It is definitely possible for people with PCOS to deal with their fertility issues and definitely become pregnant if that is your current situation or your current challenge. There is hope. What are some of the other symptoms? Difficulty ovulating, of course, no period or irregular or absent period, acne, weight gain, which I have mentioned. How do we manage PCOS? Let's talk about some solutions for PCOS. Yes, lifestyle management is good. Lifestyle management being moderate exercise is even good for everybody. Moderate exercise, balanced meal, low refined carbs, high fibers, protein, and all that. Sustainable weight management. Sustainable, not ridiculous. Because even 5 to 10% weight reduction actually can really help to improve ovulation. And you need to be ovulating to be able to see your period. You understand? The next thing is medication. That's one of the most common way we treat PCOS. We prescribe medication. So we prescribe ovulating induction drugs if you're trying to conceive. We prescribe some hormonal contraceptive to regulate your menstrual cycle. Prescribe metformin for insulin resistance. Most men with PCOS over time I tend to have come down with diabetes mellitus. So most times, and it's also metformin can also help actually with regulation of hormones. So we tend to prescribe that. It's a very common medication we prescribe for women with PCOS. Then long-term monitoring. Monitor PCOS can, like I mentioned, increase the risk of diabetes, hypertension. So it is very, very important to really monitor yourself and monitor your body. PCOS, like I said, can be manageable, can be treated. but it requires a lot of patience. And it also requires you to also give your body time. I've seen a lot of women that are struggling with PCOS and not giving their body time. When I mean giving your body time, they keep bombarding their system with so many things, so many drugs, so many things, so many injections, they keep changing their doctors. You need to give your body time and to be patient and trust your body, trust yourself, and trust God. It is very, very important. The third medical condition, most common, is fibroid. Fibroid is very, very common in Nigeria. What are some of the symptoms? We have irregular menstrual bleeding, long menstrual bleeding, intermenstrual bleeding, that bleeding sometimes twice in the month or twice during that menstrual cycle, painful menstruation, spotting, the list is endless, bloating, the tummy becoming enlarged depending on the size of the fibroid. What are some of the solutions for fibroid? I've had this question asked me several times. I'm going to answer it once and once and for all. One, monitoring. For small fibroid without symptoms, most of the time we tell you to monitor. We say repeat scan maybe after 6 months or after a year. Just have to monitor. And why? Because fibroid mostly is fed by hormones. We also try to check your hormonal levels to see how we can balance it. It will really help, and it will really help a long way, actually, balancing your hormones. Number two is medical treatment. And some of the medical treatments mostly is just some hormonal medication, like I mentioned, to help maybe reduce the risk of prolonged bleeding and so on and so forth. The next option actually is surgery. Now, I have seen not just videos, people telling me that, oh, there are some drugs. Till date, medically, we've not found any drug that would really help, aside from hormonal drugs that would help. Yes, like I mentioned, I said hormonal drugs help. But herbs and some other things say that it will flush out the seedlings. Please always consider your liver and your kidney before you drink certain things. Don't be so desperate to want to. And there are some fibroid sizes that, there's not amount of whatever it is that you drink that is going to shrink or reduce that size. It's the truth. And you know that. And you know surgery is the only way. Please consider your options carefully before you put your life at risk. Just because you want to cure one problem, you now gather or attach yourself to multiple problems. It doesn't make any sense. Well, the next procedure that we do now, which is also very common, but not really common in Nigeria, is a minimal invasive procedure. It's called the uterine artery embolization. It's a minimal invasive procedure that is done now to help, actually not really for big fibroids. For those ones that we see that before it grows, it has tendency to grow. This procedure is done to help shrink it, reduce it, and so that the person will be fine and not longer have fibroids. It is very important. So I want to share one very important information. There are some complicated parts of this medical diagnosis. One, a woman can have PCOS and fibroid together. Yes. A woman can have endometriosis and fibroid together, or symptoms that mimic one another. It is very, very important not to do self-diagnosis from social media. Leave TikTok alone. When I mean leave TikTok, not leave me alone. If the person is not a certified, you are not sure that this person is a certified medical practitioner, please go to the hospital to get tested to be sure so you can get the proper treatment. It is very, very important. It's very, very important. And bear in mind that this medical condition that I mentioned, like I said, they cause infertility, sexual intimacy, body image, energy level, confidence, and so on and so forth. So it's better to get tested on time, to get tested early, to start treatment on time, start treatment early, and most importantly, women, please give yourself grace and give your body time to heal. Be patient with your body. If you are dealing with any of this medical condition, please and please be patient with your body. If you have any question or you want clarification or you want further explanation on these topics that I've been sharing, You can send us a DM. You can share your comment in the comment section. I'll be readily available to answer your question. Thank you so much for watching today's episode. See you next time. Bye.